Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome to another episode of Smile Sisters.
Yes.
So today I wanted to talk about if you're missing all your teeth, are you a candidate for dental implants? Because a lot of people are like, they've told me I'm not a candidate. And what does that mean, really? Like, what makes you a candidate or not a candidate?
How much money you have?
For sure, that's a big part of it, because getting a full set of implants can cost $25,000 and above, I want to say.
25 is probably the lower limit of the fees, right?
For sure. So I just wanted to talk about what makes you a candidate. Let's just say you have the money. That part is taken care of. Now what do you need to have? So after the money part, there's only two reasons you wouldn't be a candidate.
Okay.
One is if you have severe disease, like if you're uncontrolled diabetes, you have huge heart problems, liver problems, your kidneys are failing. Like if you're sick, like really
Immune
sick.
compromise, hypertension.
Immune compromise. Yeah, but even if you have hypertension, diabetes, and it's controlled, you're still a candidate.
Sure.
Or if you're like a heavy smoker, things just fail. So one thing is if you're sick, and not just normal, like controlled stuff like diabetes, cholesterol, high blood pressure. Those things are, very normal. And if it's controlled, it's fine.
Okay.
But if it's out of control and you're sick.
So if you're not seeking medical help and getting that under control.
Yeah.
And often sometimes people who are missing a lot of their teeth also have those systemic
Right.
illnesses.
I mean, why did you lose your teeth in the first place? And those systemic diseases are part of the reason.
Sure.
And the second reason is if you have been without teeth for years, like decades, and you literally have no bone. And this happens in, I want to say, like older people who've had dentures for decades. And you just basically have no bone. But even in those cases, we can find some bone usually. So yeah, usually we can.
Yes, especially if we're doing a full mouth of implants.
Right.
That's different from if you're missing 2 or 3 teeth and you need to put the implants in those specific areas. And
Exactly.
if there's no bone in that specific area, it's complicated. But if you're replacing all your teeth with implants,
Right.
you don't need to put in 14 teeth. You only need to put in about 4 to 6 implants in the top. And so you find the locations where there is enough bone for those implants and you put them there.
Exactly. So if we split the mouth into 4 sections, so upper front, upper back, lower front, lower back. These 4 areas have very different characteristics of the types of bone that you're going to find there.
Yeah.
So the hardest areas to place implants is upper back. Why? Because first of all, the upper jaw is different than the lower jaw. The upper jaw is way more spongy. Like the bone has a lot more cavities and kind of it's not this dense bone.
It's very squishy.
It's very squishy. It's like spongy bone.
Yes.
And it's soft.
Yes.
And in the upper back, you have your sinuses. So that is 2 huge areas of just air where there's no bone. So the upper back tends to be the hardest place to find good bone.
Yes.
The second hardest place, well, I don't know if it's the second. It's kind of like a tie between the upper front and the lower back. So the upper front, same thing. It's the spongy bone. And if you're someone who's been wearing dentures for decades, that bone in the upper front tends to recede. So your whole upper jaw tends to go in. And you see people who don't have teeth, if they take their dentures out, their whole upper lip is caved in. It's like they have a big nose. But it's not that their nose got bigger. It's more that their upper jaw went in. And so they have a caved in look to their upper jaw.
Yeah. And then if you're trying to place implants that are aesthetically you want to place them so they're in the right place in their face, but if there's no bone there, that complicates
Right.
things.
So you have to like really angle it and also bring the whole denture out. I mean, you can work with it, but there's definitely things you have to adjust. Then there is the lower back. The lower back actually tends to have really good quality bone, but the issue there is that we have this nerve, the alveolar nerve that runs through our lower jaw. And if the height of the bone is not tall enough, again, if you've had dentures for many, many years, the bone tends to just go down. And now you're really getting close to that nerve. And I've seen cases where the bone has receded so much that we're actually on the nerve. And the denture actually hurts because it's actually hitting the nerve, which used to be buried in bone, but now the bone has like kind of receded and the nerve is a little bit out.
So this alveolar nerve runs in a tunnel in our lower jaw. It enters in the back of the jaw there. That's why if you are getting numb for like a filling or something on your lower teeth, usually they're numbing you way back there to get that nerve. Then it runs in this tunnel inside of your jawbone and it comes out over here. So basically when we're placing implants, we need enough bone above that tunnel.
Yeah, we need like about 8 millimeters minimum, 10 ideal. So then there is kind of like the best bone area in the mouth, which is the lower front. And there's a saying that if you have a chin, you have enough bone there. Because that area, the bone is dense and there's no nerves and there's no sinuses.
And there's a lot of bone.
And there's a lot of bone. If there's a chin, like you can literally touch it yourself and see, okay, boom, there's enough bone. So when we're looking at placing implants for a full arch case, so if you're missing full arch, first of all, let's talk about what is an arch, because someone was asking me. An arch is either all your upper jaw or all your lower jaw.
Yes.
So when we talk about a full arch case, we're talking about all the upper teeth or all the lower teeth. So when we're doing a full arch case in the upper, where am I looking for bone? I'm not going to go looking in your sinuses. I'm looking in the area in the front of your mouth, kind of like where your canine teeth are, in between that area. That's where you're most likely to have some bone. If you're missing all your upper teeth and you're doing a full set of upper implants, instead of going and trying to find bone in the back of your upper jaw where you have sinuses, we try to focus on the front, because like Azzy was saying, you don't need to put one implant for every tooth that you're missing. You can replace a whole set of upper teeth with maybe 4 to 6 implants.
Sure.
So as long as we have enough bone up there to put about 4 to 6 implants, that's enough. And same with the lower jaw. The lower jaw, like we were saying, as long as you have a chin, we can probably put some implants in there. So again, we're looking in this lower front area first, and then maybe a little bit further back.
A lot of people are candidates, and it's interesting that they get the statement, you're not a candidate. And I hear that a lot, not just about full mouth reconstructions, but even orthodontics and other things.
Yeah, why do you think that is? Why do you think people are saying, I was told I'm not a candidate? And then we look at them and we're like, but why?
Yeah.
I don't understand that.
I'm not sure. I think sometimes the perception of the patient might be skewed, and sometimes the provider or the dentist, it might not be in their toolkit, which if we don't know what we don't know, I guess.
Yeah,
so
we don't know.
Definitely seek second, third opinions for stuff like this, because you want to be able to see a provider who has that capacity. So sometimes your dentist might not be something they do or are even aware of as a possibility,
right?
Which shouldn't be the case, but it has occurred.
Yes.
For Invisalign, I get that a lot. Where people are like, I was told I'm not a candidate for Invisalign. I must get braces with brackets, and I don't want that, so I didn't do anything. But we look at them and go, well, that's not true. It's in our toolkit to use orthodontics for that, but maybe it's not in someone else's. So same thing with implants.
With implants, with full arch implants, most people are candidates. Most people, there is enough bone in those two areas, the upper front and the lower front, to put a few implants.
Yeah.
The other thing I just wanted to mention is, if you are someone who has dentures, specifically a lower full denture, they tend to be extremely uncomfortable, move around a lot.
Mm-hmm.
And that's where, if you have a chin, we can put an implant. And even adding 2 implants down there and just having that click-on denture can make a huge difference in the chewing ability and the ability to like bite into things without that lower denture moving around.
Let's talk about, that's a great point. And it really changes your quality of life.
It really does.
Being
Yeah.
able to eat, being able to chew your food without pain because your denture is pushing on your gums in a weird way and causing irritation, without it floating around, so you can't really chew the food you want. I see so many patients who've had dentures. They're like, well, I don't eat with them. They're just for show.
That's right.
I just put them on.
People take them out to eat.
Yeah,
it's like,
which is
oh my God, what is the point of these
supposed
things?
to be the point of them. They just wear them for pictures,
That's
basically.
right. Yeah, yeah.
So I think that that's a great reason to consider something like this, because having full dentures, that is a major negative thing. Well, let's talk about the options for replacing a full arch.
Right. I mean, if you have no teeth at all, you're basically down to 2 options. Well, let's just call it 3. Okay.
Mm-hmm.
So first option is the old school dentures. So these are basically just big pieces of acrylic and plastic, and they kind of sit on your gums, and they have teeth, and that's been like what's been around for hundreds and hundreds of years.
The way they stay in is like a suction cup.
It's like a
So
suction
they kind
cup.
of go up into the sort of fold of your gums and your lip. If you stick your tongue
Right.
like that, they kind of seal in there all the way around.
Right. And they go all the way back on the roof of your mouth as well. And that's a huge kind of negative that I hear for people who have missing upper teeth, is covers the roof of your mouth. The thing with it is the upper one does work pretty well for suctioning, but the lower one, it doesn't, because first of all, you have less surface area. You don't have the whole roof of your mouth to
With
use.
stable, hard
Yeah.
surface. Yeah.
And then you have the tongue moving around in there, lifting this thing up constantly. So the lower full dentures tend to be extremely uncomfortable. I think I've met maybe like less than 5 people in my whole career who are comfortable with the lower full denture.
Yeah.
Most people take them out to eat. Most people come in with like a bag of multiple sets of these things that they've had made at multiple different dentists. And they're just not comfortable because there's nothing for them to suction onto. Plus you have the tongue moving around. So it's constantly annoying.
And then the other thing is, as maybe when you first get your dentures, they fit well, but over the years, they become less retentive because the pressure of the denture against your gums and your bone makes your bone recede more.
Right.
So it becomes more ill-fitting over the years. You lose more bone. You have less ability for this thing to like have a good grip against your gum tissue.
Right. So you have to get them replaced periodically every few years, or
relined or
relined
braced.
or something.
Mm-hmm.
The second option is basically having dentures, but having a couple of implants, and it kind of like clips on like a button or something. You still have dentures. You still have to take them out at night and clean them, so they're not like stable in your mouth, that you don't take them in and out. But it's like a lot better, especially for the lower denture, like we were talking about. If you get a couple of implants there and you have something that it clips onto, it really improves the quality of your chewing and overall stability of it.
So in this case, the implants have like little, they don't have teeth on them, but they have these little, it could be different things, either a bar or they have like little buttons, like little,
like little
round
balls.
And then the inside of your denture has like a clip that sort of snaps onto these.
Right.
So it gives you some retention. You can do these with either 2 or 4 implants in
Right.
your mouth.
Right. The third option is the Rolls Royce of getting an arch of teeth replaced, is getting 4 to 6 implants and then getting a whole set of teeth kind of mounted onto those. And this replaces all your teeth. But the good thing about this compared to the other 2 options is that you don't have to take it in and out. It's like it's in there, you brush it, you floss it. It's just like, it's in there in your mouth. It's part of you.
Yes.
And
it gives us about 90% of the chewing and biting force that you would have had with your natural healthy teeth.
Right. So you can actually bite into an apple and not have
Yes.
anything jiggle around in there.
Yes, which is not the case for a full denture,
No.
or even a snap-on denture
No.
that's mounted on a
No,
couple of
it's not.
implants. It's a little more retentive, but you don't have that kind of force to do
Yes.
that with.
Yeah.
So this is the way to do it. And if you get this option, then you do want to come in and get a cleaning every 3 months, and we basically clean under and around your implant supported denture.
I mean, you do. There's a little space in there, but we do want to like see you and maintain these things.
Yes, for sure.
For sure. Yeah.
So it's the most expensive option, but that sort of gives you the most bang for your buck.
Yeah.
It's
really like
put you back to where you were from when you had teeth.
It's the closest thing to having teeth.
Mm-hmm.
Yeah.
Yeah.
Okay, so come see us at LA Dental Clinic. We do free online consults, and hope to see you soon.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.